Hi, and thank you for watching. My name is Dr. Delphine Tuo. I'm a nephrologist from the University of California, San Francisco, and practice at the San Francisco General Hospital. Today, Carrie and I are going to discuss some topics related to chronic kidney disease, or CKD. Carrie, thank you for joining me today.
Thank you for having me.
We are going to use the teach-back method, which is an effective approach for having conversations with your patients about kidney disease and other chronic illnesses. In short, I will explain key concepts to Carrie and then ask her to explain her understanding of what we discussed. The teach-back approach helps reduce uncertainty and fear while actively engaging your patient in the discussion. And after all, the patient is the central component of the healthcare team. Now, we recognize that good communication takes time, and what you're about to see may not take place in one encounter or just one office visit. But we will address a few topics today, including what are their kidneys, what is chronic kidney disease, how it's tested, in ways that patients can help protect their kidneys. So let's start by talking about what the kidneys do. So Carrie, I don't know if you know much about the kidneys, but the kidneys' main role in the body is that they filter the blood. They filter blood, help hold on to good proteins and good nutrients in the body, and get rid of any extra wastes and extra water that the body doesn't need. Those extra waste products and that extra water is then excreted in the form of urine. So your kidneys do make the urine in your body. That's one of the biggest roles that the kidneys play. The other thing that they do is that they hold on to protein and prevent protein from leaking into the urine. So that is why, as we'll talk about later, the two main tests related to kidney disease are associated with the filtering of the blood and the protein in the urine. Does that make sense?
Yes.
Okay. The other things that the kidneys do, because they do lots of other things, they're magical organs, is that they help the body produce red blood cells. They help keep your bones healthy, and they actually help control blood pressure in the body. Okay?
Okay.
So to make sure that I've explained this in a helpful way, can you tell me how you would explain it to a family member?
Sure. So the kidneys are responsible for filtering our blood and creating urine, but making sure that our bodies get rid of things they don't need, but keeping things that they do need.
That's exactly right. And one of the things that it holds on to in particular is a protein called albumin, which we'll talk about in just a second.
Okay.
Great. And so just moving on, when the kidneys are damaged, it means that they're not filtering the blood as effectively, or they're allowing protein to dump into the urine. They're not holding on to that albumin as they should. And when kidneys are damaged, we call that chronic kidney disease. Okay?
Okay.
There are many stages of kidney disease. It starts off very mild at stage 1, and then can move on to stage 2, stage 3, all the way to stage 5 kidney disease, which is when the kidneys are severely damaged, such that they're not filtering well enough, or there's a lot of protein leaking into the urine. Okay?
Okay.
When that happens, it is possible that we need to replace the kidneys with a transplant or with dialysis, which you may have heard of before. And I mention this today just because it's important to talk about and put on your radar, but it's not something that we need to discuss in depth. Okay?
Okay.
CKD, or chronic kidney disease, happens over time. It usually doesn't happen overnight. It's a chronic disease, which gives us plenty of opportunity to try to manage it, treat it, prevent it from getting worse, and gives you plenty of opportunity to become healthy and help your kidneys become healthy as well.
Okay, good.
So when talking about or explaining chronic kidney disease to patients, there are a few key points that I'd like to usually highlight. One is that it is important to use the term chronic kidney disease, or CKD. That is the term that is most often used in educational materials, and it's important for the patient to be able to connect the educational material that they may be reading with their own disease. Also, it's important to mention the stages of chronic kidney disease, but I don't often harp on them because that's not necessarily what resonates with the patient directly. But the kidney disease stage is important in directing the type of conversation that you have with the patient thereafter. It's really important to give patients and caregivers the information that they have the opportunity to help slow the progression of chronic kidney disease. Having mild CKD does not mean that somebody will be on dialysis shortly. And it's important to give patients that hope and that time and the opportunity that they can slow down their progression. Next, we're going to talk about how we test for chronic kidney disease, or CKD. There are two main tests that we use. The first is a blood test. It's called estimated glomerular filtration rate, which is a mouthful, but EGFR is the acronym that we tend to use.
Okay.
And EGFR just tests exactly that. It tests how the kidneys are filtering the body or filtering the blood. An EGFR of less than 60 suggests that somebody has mild to moderate kidney disease. The second main test that we use is a urine test. It's called ACR, or albumin to creatinine ratio. An ACR tests the amount of albumin that is in the urine. And if you remember when we talked about the kidney's role in the body, those are the two main roles, right? It filters the blood, so that's why we test for filtering with GFR, and it keeps protein or albumin in the body, preventing it from leaking into the urine, which is why we test for albumin in the urine. An analogy I like to use is a coffee filter. So I think of the kidney like a coffee filter, and it holds on to the coffee grains, the albumin, and the important entities in the body, and it allows extra waste products and extra water to filter out into the urine or filter out.
Okay.
So just to make sure that I've explained that helpfully, how would you describe the tests for kidney disease to me or to a family member?
Sure. So it sounds like there are two main tests that you would like to have. One being a blood test to take my EGFR.
That's exactly right.
And so I would want to have an EGFR of greater than 60. Anything lower than that suggests some decline.
Yep.
The other test is a urine test called an ACR,
great.
and that tests how much protein might be leaving your body. That also indicates how much the kidneys may be losing protein.
Yeah, that's exactly right. And both tests are important, which is why we follow both of them over time. And I think it's important for you to keep track of those tests, both the EGFR and the ACR, because both will help you know how your kidneys are progressing over time. And if you have trouble accessing your online portal or your online information, make sure that you contact our office so that we allow you to do that.
Great, will do.
Excellent. So in terms of testing for chronic kidney disease, I think it's really important to discuss both EGFR and ACR with patients, as both provide complementary information about kidney disease and its trajectory. I think in terms of frequency, it's important to check both in all individuals at high risk for kidney disease. That includes individuals with hypertension, as well as diabetes, and those with family history of end-stage renal disease. And it's important to check once and then at least annually thereafter so that you can monitor the progression of kidney disease and look at the effect of your treatment on the EGFR or ACR. And abnormal EGFR or ACR results should prompt a nephrologist referral. In general, individuals with an EGFR of less than 30 definitely need a referral to a nephrologist, and I would recommend referring earlier as well if individuals have high levels of albumin to creatinine in their urine. And lastly, urine albumin to creatinine ratio, or ACR, and urine protein to creatinine ratio, PCR, provide very similar information. I tend to describe ACR to patients, as I did with Carrie earlier, because that's what's listed in most of the educational brochures for patients. But I would just pick one and stick with it over time, so again, you can follow the impact of your treatment on the ACR quantity. So now let's talk about the symptoms associated with chronic kidney disease. The good news is that most people are asymptomatic, meaning that they don't feel any symptoms associated with kidney disease until kidney disease is very severe, so stage 5, when their EGFR is less than 15 or so. But even with a normal EGFR or more mild filtration damage, you can still have protein in the urine. As we had talked about before, the ACR can still be elevated. And when you have protein in the urine, you can have symptoms that are associated with fluid retention, so means extra water being held into the body. So for example, you can have swelling of your lower extremities or even puffiness around the eyes. That could just be water that hasn't been excreted effectively.
Okay.
Just to make sure that I've explained that in a helpful manner, what are some of the symptoms that you'd want to look out for with earlier stages of kidney disease?
Sure. So, based on what you're saying, if the body is retaining too much fluid, edema, which is swelling of the feet and ankles,
Yep.
But also could be puffy around the eyes.
That's exactly right. And oftentimes people will feel that puffiness actually in the morning because they've been horizontal at night, and the water, which uses gravity essentially to settle, will settle around the eyes.
Okay.
And while you won't experience this anytime soon, we can also talk about a few symptoms that you might feel later on with more severe chronic kidney disease, just so that it's in the back of your mind. And those types of symptoms occur when the waste products build up in the body. So when the kidneys are not filtering well, when their eGFR is low, then the waste products can build up. And those can cause things like fatigue, or lethargy is the word that you might see used, poor appetite, a poor taste in your mouth. Some people will complain of a metallic taste or a bitter taste in the mouth, and just sometimes feeling just tired, napping early, feeling tired throughout the day, having trouble concentrating. Okay, so those are the types of symptoms that I'd want you to be on the lookout for later on. I just mentioned this now so that you are aware.
Okay.
Okay. And how would you describe those symptoms to a family member if you had to tell a family member to be on the lookout for later stage symptoms?
So, lethargy or feeling tired,
Exactly.
lack of appetite, a bitter taste in the mouth.
Yep, that's exactly
Did I
right.
get it right?
That's exactly right. And so it's important that if you or a family member start feeling some of those symptoms, either of the increased swelling of the legs around the eyes or from the increased buildup of waste, that you let either me or one of your other doctors know so that we can evaluate you more quickly.
Okay, we will.
Excellent. So now let's talk about how to manage your kidney disease, both you and I together. So our goal is to keep your kidneys as healthy as possible and to keep your eGFR as stable as possible to prevent it from getting worse, or preventing CKD progression, as we like to say. The way to do this really depends on the cause of your kidney disease and at what stage it is right now. While there can be many causes of kidney disease, the two main ones in the United States are diabetes and high blood pressure. And so it's really important that we work together to try to control your high blood pressure and control the diabetes, which also helps control the kidney disease and prevent it from getting worse. Okay?
Okay.
So if somebody asked you what were the two main causes of kidney disease in the United States, how would you answer that?
High blood pressure and diabetes are the
Exactly.
main causes.
Exactly, yeah. And I just harp on that because it's really important that we realize that while I'm very nephrocentric and I care about your kidneys, it's also important to realize that your kidneys are part of the larger cardiovascular system in the body. And so making sure that your blood pressure is good, which helps the heart, also helps the kidney. Okay, that's why I harp on it quite a bit.
Okay.
So other things that we can do to try to keep your kidneys as healthy as possible include a healthy diet, as well as physical activity to keep your weight nice and healthy, and making sure that your medications are safe for you when you have kidney disease. So when talking about diet, there are a lot of people that have questions about diet with relation to kidney disease, and I think it's a really important question. In general, I recommend a low-salt diet. This not only is helpful for blood pressure, because additional salt can increase your blood pressure, but it's also helpful to decrease the additional burden or the additional weight that the kidneys have to work with. Okay, so a low-salt diet is really important. And I also recommend that individuals with kidney disease see a nutritionist, because they're going to be able to help you devise an individual treatment plan or an individual diet plan that is great for you at your level of kidney function. Individuals with mild or moderate kidney disease don't need to necessarily have the same diet restrictions as individuals with more severe kidney disease. Does that make sense?
And will you refer me to a nutritionist?
Yes, exactly. So yes, I will go ahead and refer you to a nutritionist. And I think after you go see that individual, he or she can let me know what they recommended to you. And it'll be important to keep that communication going.
Great.
Okay? So in addition to diet, physical activity is super important. And that doesn't mean you have to run a marathon every day. It just means getting more activity. Okay?
Okay.
That may mean walking, that may mean swimming, that may mean running around with your kids. All of that is super helpful. It's just additional activity. Helpful not only for your heart, but also for your kidneys. Okay?
Sounds good.
And the last thing I wanted to harp on or talk about are medications. You know, we prescribe a lot of medications that are really important for a variety of illnesses, including high blood pressure and diabetes, but all of those medications could also have an impact on the kidney. So it's really important that whenever you have a new medication prescribed for you, or you pick up a new medication from the pharmacy, that you ask whether it's safe for you to take with your kidney function in you having chronic kidney disease. Okay?
Okay.
And I'm talking about medications that are prescribed as well as medications that you might pick up over the counter. You'd be really surprised. Common things such as what we call NSAIDs, non-steroidal anti-inflammatory drugs. So those are pain medications such as ibuprofen, Motrin, Aleve. I'm sure you've taken some of those in the past. So those are really helpful for pain, but they can actually cause kidney damage. So again, it's really important that any new medication over the counter or prescription that you let your pharmacist know, or ask the pharmacist or ask your clinician whether it's safe for you with kidney disease. Okay?
Okay.
So I just went through a lot of information about how you can help keep your kidneys healthy. To make sure that I explained it in a way that was clear, can you just repeat back to me some of the most important points that you'll take home with you?
So you really underscore the importance of a healthy diet and working together with a nutritionist
Exactly.
to make sure my diet is in line with where I'm at with my kidney disease. You suggested just increasing activity, not necessarily running a marathon, but just increasing physical activity. And lastly, you just asked that if there are any new medications prescribed to me, that I would make sure that they are not going to cause further kidney damage by running it by a pharmacist or by you.
Excellent. That's perfect. Two additional things that I would want to mention is that smoking can be really harmful for your heart, as you know, but can also be harmful for the kidneys. So stopping smoking is of particular importance. And if you need some help with stopping smoking, I can make a referral for a variety of different ways or medications to help you stop, patch, gum, etc. And the second important thing, I emphasized a lot about medications, but herbal supplements. I don't know if do you use herbal supplements at all?
I take vitamins over
Okay.
the counter.
Okay, and where do you get those vitamins usually?
Online.
Online. Okay, so one important thing is the next time you go to your doctor's office or you come see me, it would be great if you could bring all of those medications and those vitamins with you so that we can take a look at it. A lot of herbal supplements are safe and can be healthy for you, but there are many that can actually interact with your other medications or can cause the kidneys some harm. So it's really important that I just take a look at them and make sure that they are safe.
Sure
Okay?
thing.
Excellent. So these are the treatment strategies that I mention the most when chatting with patients with kidney disease. That includes diet, and I really emphasize the importance of a referral to a dietitian or a nutritionist in order for the patient to have an individualized diet plan. And oftentimes that referral can be covered by insurance or Medicare. Other important items, I discuss physical activity, as you saw, and really emphasize the importance of medications. I think medication safety is something that resonates really well with patients and is also of extreme importance. Not only medications that are prescribed, also over-the-counter medications, as I mentioned, and herbal supplements. So just to recap, today we talked about the roles of the kidney in the body, what is kidney disease and the different stages. We talked about ways to manage your kidney disease over time. And now the last few things I wanted to mention is how important it is, now that you know that you have kidney disease, to disclose that to all of your other clinicians and all of your other doctors. It's important that they know you have kidney disease, not only because of the medications that they may prescribe, which we talked about earlier, how some of those medications can harm the kidneys, but also some of the diagnostic tests that they may order, things like CT scans or CAT scans with contrast dye. contrast dye can be really helpful to see what's going on in the kidney and to see the blood vessels in the kidney, but it can also cause some kidney damage, either acutely, transient kidney damage that gets better over time, or it can cause kidney damage that is irreversible. So that's why I'm harping on that a little bit now. It's important that you let your other doctors know that you do have kidney disease so that they keep that in mind when those tests are being prescribed. Okay?
Okay.
This concludes our presentation. The effort to address the challenge of kidney disease and improve CKD awareness is ongoing, and continuing engagement with our patients is an important way to help improve communication, healthcare, and outcomes. This is of particular importance for primary care clinicians who are really on the front line of identifying CKD and managing early and moderate chronic kidney disease. I want to thank Carrie for her help with this presentation and ask you how it went and how your thoughts were about this interaction.
Thank you for having me, Dr. Tuo. I really enjoyed being spoken to this way, and I feel that I am armed with information that I can now share with the people that are important to me that may end up being really integral into my health journey. So I really learned a lot, and I feel like I could really speak to everything that you've taught me today.
Excellent. Thank you for sharing. I would also like to thank the Veterans Affairs Center for Innovation for their support. And on behalf of the National Kidney Foundation and patients with kidney disease, thank you for watching.